The cover there.
Yeah.
Very good.
All right, how are we going, guys? 7 9. Okay.
Well, good morning, Queensland. It's a little bit wet out here at Bunnings at Stafford, but that is not going to stop us in promoting our Bunnings vaccination weekend, where we'll have 33 Bunnings stores across Queensland offering up the vaccination. So we know people love coming out to Bunnings on the weekends and getting that sausage sizzle on your way in or out while you do some great shopping. Well, now you're going to be able to get a vaccination as well. So Stafford here will be open from 9 a.m. to 3 p.m. Saturday and Sunday, and jump online and have a look at all of our Bunnings sites and their times that they'll be open this weekend. So good news for Queensland. We have no new community cases. We have one new case overseas acquired and in hotel quarantine. Was in hotel quarantine, actually a flight crew who had already left Queensland. We do have an interstate case of a truck driver who has driven into Queensland, been in the community for one day, but we are not concerned. There was one truck stop, so very, very limited exposure, and that person is already in hospital. So we have 28 active cases, 9,405 tests were done in the last 24 hours, and 16,072 vaccinations. And talking about our vaccinations, we've hit 71.35% first doses and 54.77% second doses. And the exciting news is yesterday we hit 80% double doses for those Queenslanders 70 years and older. So that is fantastic. We know this is one of our very vulnerable groups. To know that they're already 80% double dosed is wonderful. So the challenge is this: if you are under 70, you need to get those rates up to compete with all of our elderly people in our community. You should be getting vaccinated and getting to that 80% rate for us as well. So come out this weekend, go to a Bunnings, go to one of our Queensland Health mass vaccination centres or local community hubs, your GP or your community pharmacy. There is no reason to delay getting the vaccine now. There are so many options in so many places. It's there, it's available, and it's up to you to make sure that you're getting vaccinated to keep yourself safe and to keep the community safe. I'll hand over to Dr. Young now, and then happy to take some questions.
Thank you, Minister. So it's lovely to be here at Bunnings. A bit wet today, but I've looked at the Bureau website and the weekend looks fantastic. So please come out on Saturday or Sunday to one of those 33 Bunnings stores. Have a snag when you come in. I certainly had one the other week when I went to one of our schools, so I'll test the difference between a snag at a school or a snag at Bunnings. I'm looking forward to it. Also do a bit of shopping. I intend to buy a new rose bush. I managed to kill one of mine, so I've got to replace it. So there's so many reasons to come out to Bunnings and get vaccinated this weekend. The most important one of all, of course, is that getting vaccinated is the best way to protect yourself and your family from getting infected with COVID. We are, all of us, going to end up being infected with COVID. Every single person in Queensland. But if you've been vaccinated, it's highly unlikely that you'll get sick, and you're definitely very unlikely to end up in hospital or in ICU. So we did have 2 new cases today in Queensland. One of them was a flight crew member who got tested on entry into hotel quarantine, as they always do, and actually left before the result came through. So they were positive. They're actually on their way to Papua New Guinea, so we've contacted the National Incident Room and they'll let Papua New Guinea know to manage that. So that's one case of no risk to Queensland, but a risk out there elsewhere, so we'll manage that. Then the second case is a truck driver who's had 2 doses of Pfizer, which is fantastic to see, and you would have seen that all truck drivers driving into Queensland now from other states where there are cases have to have had at least 1 dose of vaccine. This truck driver had had 2 doses, his second dose on the 2nd of October. He drove up from Victoria. He arrived coming through the Gundawindi border area, coming through Ipswich. He got a phone call from Victoria. He immediately pulled over, contacted us, and he's now in the Prince Charles Hospital, so he's been no risk to anyone at all. He's totally asymptomatic, and I thank him very, very much for what he did to respond so quickly. And I thank all truck drivers because they have been fantastic. And you would have seen we had that flurry of cases not long ago, but we've not seen those same numbers going forward, which is excellent because we need our truck drivers to keep moving produce and goods around the country, and they're doing that very, very well for us. So the next thing, though, we all need to do in Queensland, we've done a brilliant job to date in keeping the virus out of Queensland. We now know that no matter what we do, it will arrive and every single one of us will end up getting infected. But if you've been vaccinated, that's the point of vaccines, they'll protect you. So there's a real challenge on. This weekend, 33 Bunnings stores. Let's see how many Queenslanders can get vaccinated when they pop into their local Bunnings. Thank you.
New South Wales this morning has announced no quarantine, home or hotel to fully vaccinated overseas travellers. Does that make it less or more likely for us to open our borders sooner?
Look, we are concentrating on what we can do here in Queensland, not what New South Wales or any other jurisdictions doing in relation to their quarantining and borders. We need to get Queenslanders vaccinated. If people want our economy to open up, if we want to support tourism in this state, if we want to support businesses, if we want to ensure that we have our schools open and our businesses open and our hospitals functioning, they need to get vaccinated. It's in the hands of Queenslanders how quickly they want us to open up. They must get vaccinated.
So it doesn't change your thinking at all?
No, the issue of international borders and international quarantining, this is an issue for the Commonwealth Government and National Cabinet, and I'm sure that National Cabinet will be discussing these issues and how this would work. This is an announcement of New South Wales. We've just heard it this morning, haven't seen any detail of how this would work and whether these people will be allowed to travel around the country as soon as they arrive through Sydney. So, it really is for the Commonwealth and New South Wales to explain how they see this working.
Is that Tourism Minister has indicated on the radio today that there could be a decision on the Queensland border before National Cabinet meets next month. Are you aware of that?
Oh, look, we continue to look at the modelling and to work on, the phases of how we get out of this pandemic. But we know there is one thing that we can all do and must do, and that is vaccination. That is the only way out of this, is vaccination. And we want to see people right across Queensland being vaccinated. We don't want to see southeast Queensland fully protected with high rates of vaccination, but our regions and small towns and our vulnerable communities elsewhere in Queensland having low vaccination rates, and will become our hotspots. Will become the areas of ground zero where there will be mass virus spreading through those communities. The virus will go into every single one of our towns. Once the borders open, the virus will go into every town, every city in Queensland, in Australia. The question is, are you going to protect yourself and get vaccinated now?
So when will the government be releasing a roadmap then?
Look, we will continue to do the work on this and those decisions will be made by the Premier in consultation with the Chief Health Officer and taking advice from Dr Young.
Yourself and the Premier have recently started saying, Queenslanders have 5 to 6 weeks to get the vaccine. Does that mean a roadmap will be released in the next 5 to 6 weeks?
The reason why I'm saying 5 to 6 weeks, and the announcement today by New South Wales makes it even more critical, is if you get your vaccination today, it is going to be 5 to 6 weeks before you are fully covered by that vaccine. And that's why you can't afford to wait. If New South Wales are going to be letting international arrivals in with no quarantine from the 1st of November, we've got no time to waste. This virus is coming, it's coming to Queensland. Everyone needs to get vaccinated now, because we can't talk about the plan forward and opening up if Queenslanders aren't coming out and getting vaccinated in big numbers. So that's what we need, and that's what this weekend's all about. Coming along to Bunnings, coming along to one of our vaccination clinics, coming along to a GP or a pharmacy and getting vaccinated now.
So on Bunnings, this has been open. They've been doing this in New South Wales and Victoria since August. Why has it taken so long?
Well, New South Wales and Victoria have been given a lot of extra supply. They were given extra supply, and it actually was taken off other states, including Queensland, to provide extra supply to New South Wales and Victoria. We understand why. A mass outbreak, over 100,000 positive cases now since the 16th of June. But we have to be realistic and understand that we haven't had the supply until very recently to be able to open up many more sites. And pharmacies have only had Moderna to offer in the last 2 to 3 weeks.
Would it almost have been better for us to have a mass outbreak to force people to get vaccinated?
Well, there's over 500 people who have died so far from one outbreak starting on the 16th of June. So would it have been better if we had opened up quickly, have 100,000 positive cases and hundreds of people die? No. No, we've had 7 deaths, 2,070 cases since day one. Our job is to keep Queenslanders safe. We're going to do that in a sensible, responsible way.
Does this decision by New South Wales with international borders make you more hesitant to open up Queensland's border?
No, we will look at what is happening here in Queensland and our vaccination rates and the measures that we can take to keep Queenslanders safe. That's been our priority. The fact is New South Wales is already in the middle of a major outbreak. Victoria's already in the middle of a major outbreak. So the chance that they might open up and get even more cases, their risk is already high. They're already operating at that level. So we're concentrating on when the virus comes to Queensland, and it will, what are we going to do to protect our community?
The decision by New South Wales is premature on the face of it.
Look, that's up to New South Wales, but they've just announced this morning. Scott Morrison's going to have to explain how he sees this working in one single state when it's international borders. And I hope this is discussed at a national level with all of the premiers, because that's where it should be.
While you're here, Minister, the LNP is releasing this morning 600 pages of quite damning statistics on ambulance service and paramedics and hospitals. How do you respond to those?
My response is that why did the LNP sit on this for 3 weeks? They've had this RTI for 3 weeks. They say it's explosive, they say it's secret data, but they themselves have sat on this for 3 weeks. We have just had a week of Parliament where every single day the Leader of the Opposition has had the opportunity to ask the Premier and myself as the Health Minister questions about this data, and they have not asked one question on it. Why did they stand up on Friday morning at the end of a parliamentary sitting week and drop a document that they've had for 3 weeks? Maybe it's because they want a distraction from talking about their shadow health spokesperson, who is a financial member of a professional association that is questioning the efficacy of vaccine and has now lodged a legal challenge to stop us mandating the vaccination for our health workers. David Crisafulli, Ros Bates needs to say whether they support health workers being required to be vaccinated or not.
Still, if the data's there...
Well, let me be clear about this data. Since March this year, we have been facing significant ramping issues. This data is for April and May. May is when we hit our peak when it came to ramping. We have had, since May to now, a 20% reduction in lost time on ramps. A 20% reduction because of the initiatives we've put in place. $263 million investment, bringing 461 beds online. Many of those beds are already operational. There's many more coming on in the next 4 to 6 weeks, and we have more beds at our hospitals at Ipswich, Westmoreton and QE2 opening up between now and February. So we've put in place a whole lot of measures that we are now seeing positive turnaround. But let's be clear, every single state and territory is facing problems with ramping, ED pressure and bed capacity. That is why every health minister has written to the Commonwealth. And there's one thing, if David Crisafulli actually wants to ease pressure off our health system, he can pick up the phone to Scott Morrison and ask him to back in the letter sent by the health ministers that asks for Scott Morrison to free up 600 beds in Queensland hospitals today that are taken up in aged care and disability.
Given there are thousands of people still crossing the border every day in northern New South Wales into Queensland, Has the decision of the New South Wales government dramatically increased the risk of a COVID outbreak in Queensland?
I need to go and analyse that decision. So it's only just been announced this morning. So before making any comment, I need a little bit of time to work out exactly what it means.
And do you think it would be irresponsible to reopen the state's border to interstate hotspots if that 80% vaccination rate isn't uniform across LGAs?
I need to go and look at what will happen in New South Wales and the impact.
Do you anticipate
Standing out the fake certifications, some of the people that received it were Queensland employees. How is that?
So we're working through, we don't accept anything like that. We go and make that decision ourselves because we're health, so we can. It's much, much harder where she provided that certification to non-health entities because it would be more difficult for them to work out that this is not a registered practitioner. So I'm not at all concerned about the one she gave to health employees. I'm concerned about those employees and what they thought they were doing, but I'm not concerned that there's been any risk to the health system.
Been reports that there's been COVID fragments found in hands, waste.
Yes, yeah, so we see that quite regularly, and it means we go in there and do some more testing to look at whether there's a known case there, because we know that we can see cases continue to shed viral particles that aren't infectious for up to a year, even longer.
Do you anticipate making any decisions on the border or other easing restrictions before you start as governor?
That's up to the Premier. So I'm just working through all of that work at the moment, and I'm working it through with my replacement so he understands where these decisions are moving on.
Do you think it's more likely or not likely that people from Sydney and Melbourne will be able to come to Queensland for Christmas?
There's just been an enormous change this morning that I haven't been able to get my head around, so I need to go and work out what that change means. And it's not just a change that will impact on New South Wales. Opening the borders to New South Wales then leads to a flow on to every other state. So I just have to recalibrate my thinking that I've been coming to over the last few weeks.
Just in terms of Queensland's own home quarantine trial, do you expect that will expand?
It's going extremely well. So we're well over 400 people now going through that process, and it's been working well. So yes, we'll review it, and there's every chance that we'll
We've actually hit over
extend it.
800 now.
When will that
800?
Yes,
Sorry, when will
as
that
of this morning.
Wow.
review take place? Of the
We're doing it continuously. Yeah.
So there are people who need to relocate to Queensland. There's so many that
There are.
have houses to go to. There's
Of course.
paying mortgages already.
Yes.
When can they come?
Yep, so that's part of that process. So we wanted to start with Queenslanders because they just had a little bit more support. They could come back, they already knew people, they already had houses set up, so it was much easier to start with them. And remember, this trial only started on Monday, so then the intent was always to see how that went and how we could safely expand it to other groups.
Do you
I think
anticipate
it's critical. Some of these people say there's
Of course it is. Of course it's critical, yes, so we're working as quickly as we can, but the most important thing people can do to support those new arrivals coming into Queensland, and Queenslanders are always so supportive of new people coming, is to get vaccinated, because the quicker communities get fully vaccinated, the quicker we can remove those sorts of restrictions.
Dr. Young, you said the Premier would make decisions around the border. Do you anticipate making recommendations to the Premier about what to do before you become governor?
Of course, yes.
And Dr. Young, are there people in hotel quarantine currently who would be eligible for home quarantine? And would they be invited to be part of the trial to free up some of those rooms?
Of course, that's something we always look at whenever we change those situations. But it's something to look at rather than to think that that will happen because they're already in hotels. So what we would usually do is if there's no quarantine requirement because we undeclare a hotspot, then we'll allow those people to leave. We don't normally move them into home quarantine.
And Minister, you mentioned reviewing, obviously, the big decision that's happened in New South Wales. Do you think you'll be able to provide a bit more detail? When do you think? Early next week?
Let me see it, please. Let me go through it. All I've seen so far is a very brief text message. I need to have a bit more information than that to work out what should be done.
Can I ask Minister,
Last couple of questions.
are people still working in Queensland Health while unvaccinated?
So we've got a range of arrangements in place. Some people have taken leave. Some people, because of where they work in the hospitals, are being required to wear extra PPE. So we're working through those particular arrangements. But can I say that, you know, a large majority of the workforce, in fact, so far we have required staff who are unvaccinated to come forward and proactively tell us they're unvaccinated. And of that cohort, it is less than 2%. So I'm very pleased the take-up rate that we've had across our health workforce. It's been incredible, and it shows their commitment to their work colleagues, to themselves, and also to every patient that comes into our hospital system.
Can patients refuse treatment from unvaccinated staff?
Well, no. At this stage, ultimately, it's the patients. But remembering, we have a large majority of our health workers, especially those who are working on the front line, are already vaccinated. So the risk or the chance of patients being cared for by someone who is not vaccinated is extremely small because of the large number of staff, and particularly clinicians, doctors that are highly, well over 98%, not 100% in many of the hospitals already.
Gold Coast residents have raised concerns about community support workers who are providing in-home care but aren't vaccinated. Why is there no mandate for the community support staff to be vaccinated given they are?
Well, a number of these community support are private. They're managed by the Commonwealth. We are managing the staff that we're responsible for in our aged care and in our hospitals. It is the responsibility of the Commonwealth in relation to primary and allied health care to the community and any mandating of vaccination. So far, it's the Commonwealth who have said they want it, and they require the states and territories to do these things. But really, if there's going to be a widening of mandating of people being vaccinated in workforces, that really should come from the Commonwealth. They've got the powers to legislate work arrangements, not the states.
Last one now, we've got to go, the rain's on the way. So.
Do you think we'll still need quarantine this time next year?
Oh, I hope not. Look, how quickly we come out of these restrictions, how quickly we open our borders domestically and internationally is in the hands of Queenslanders. You can decide. Go out and get vaccinated today. Yeah, that is the one thing that we need to protect our community, and we can provide the pop-up clinics, the mass vaccination centres, the pharmacies and the GPs. We can provide the vaccine, but we can't drag people in to get vaccinated. That is up to you as Queenslanders. What sort of Christmas do you want to see? What sort of 2022 do you want to see? You know, we want to make sure that we can get back to the lifestyle that we love and travel around and see loved ones, but we can't do that without your help. And we need to support business in this state. Tourism needs our help. Tourism needs us to get vaccinated. Do it for tourism, do it for our health workers, and do it for all Queenslanders. Thanks, everyone.
Thank you.